Let's take a look at the paranasal sinuses. Paranasal, meaning they're around the nose area, all right? So there are 4 paranasal sinuses: the frontal sinus, the ethmoidal sinus, the sphenoidal sinus, and the maxillary sinus. So because these are hollow spaces, you can have pressure build up in them. That's basically what a sinus headache is. When the pressure of the outside air is not the same as the pressure of the air inside the sinus, that pressure difference can push on nerves and cause pain. That can happen sometimes because mucus, the whole, as we'll see in Bio 202, the entire nasal cavity is lined with mucus, cells that create mucus. And so especially if you've got, allergies or you get a cold, the mucus can basically block up the passageways. Normally these paranasal sinuses should be able to communicate with the outside air. They're basically just a way to allow the pressure inside of your head to equalize with outside pressure. But when they get blocked up with mucus, then you get pressure differences. Those can be painful. That's a sinus headache. So you can see, the person in the picture right there, that's probably a frontal sinus issue. Sometimes you'll see people holding their hands on the bridge of their nose going, oh, my sinus headache. That might be an ethmoidal or sphenoidal problem. Sometimes people feel sinus headaches, underneath their eyes. You'll see people rubbing underneath their eyes. Again, these are the paranasal sinuses. They're hollow spaces, and differences in air pressure can lead to a sinus headache. So here you see a photobomb in an x-ray, which would be awesome. If I were an x-ray tech, I would do this all the time with my friends, and I'd probably get fired, which wouldn't bother me. So, but look at the skull on the left. See above the eye sockets, above the orbits? See how there's that kind of darker butterfly sort of shaped pattern? That's the frontal sinus. See, it's hollow inside of there. That's the frontal sinus. Cool, huh? So the zygomatic bone, your cheekbones, all right? That's, people say, oh, you have beautiful high cheekbones. Yeah, they're talking about your zygomatic bones, at least in part. Lateral wall of the orbit along the sphenoid, along with the sphenoid, part of the zygomatic arch. So again, if you take the little flap on your ear is called the tragus. If you start with your finger there and run all the way over to underneath your eye socket, feel that big giant bony ridge. That's your zygomatic arch. Now the zygomatic arch is composed of 2 bones. It's composed of the temporal bone and the zygomatic bone. Now here's a cool thing. Where the temporal bone has what's called the zygomatic process. The zygomatic bone has the temporal process. So the process is named not for the bone that it's on, but for the bone that it connects to, which actually makes sense, because you would want the name of the process not to be named for the bone it's on. You already know it's on that bone. You want it to be named for the bone it connects to, because that tells you where it goes. So again, the zygomatic arch is composed of the temporal process of the zygomatic bone and the zygomatic process of the temporal bone, okay? You can kind of see that in this diagram. Coronal view is not the best. Sagittal view is better. So let's move on to the lacrimal bones. Those are the ones that are going to kind of around the corner from your eye socket, like where you get little eye boogers. As we'll see later, you've got the lacrimal caruncle there. But that's where there's a tube, a little passageway for tears to drain. So lacrima, crying. Part of the medial wall of the orbit. Lacrimal fossa houses the lacrimal sac, which is where tears collect. The inferior nasal concha, these are individual bones not part of the ethmoid. So the superior and middle nasal conchae are part of the ethmoid. The inferior nasal conchae are their own 2 separate bones. And again, you can see them in the illustration. There's those little pinkish colored bones hanging down at the bottom of the nose hole. Okay? Now for the mandible. There's the body, the angle, and the ramus. So the main part in the front, the most anterior part, we call the body. Then the part that goes up, see the part that ascends right there, that has the coronoid and condylar processes on it, that part is called the ramus. The word ramus means branch. So see, that's like it's branching off of the body. And the place where the ramus and the body come together is called the angle. because that's the angle where the two join together. All right, so the body, the angle, and the ramus. The condylar and the coronoid processes. So the condylar process, that fits into the mandibular fossa of the temporal bone. That forms your temporomandibular joint, your TMJ. The coronoid process, what do you suppose that's for? Remember, processes either form joints or they were for muscle attachment, all right? So the coronoid processes are where some of the jaw muscles attach, okay? You can see there the mental foramen as well, and the alveolar processes on the lower mandible. Again, we saw the alveolar, on the mandible rather, not lower mandible, just the mandible. We saw alveolar processes on the maxilla. So again, these are the ridges in between the alveolar sockets, okay? That's where the teeth fit in, the alveolar processes. And then the mandibular and mental foramen, again, that's where the mental nerve comes through, the mental foramen. Also, a blood vessel goes through there. Mandibular foramen, also nerves and blood vessels, okay? So taking a look at TMJ syndrome, temporomandibular joint syndrome. Condylar process of the mandible together with the mandibular fossa of the temporal bone form the temporomandibular joint. And sometimes this can become a very painful area. So TMJ syndrome is a dysfunction to varying degrees of the temporomandibular joint. There are many, many causes, numerous treatments as well. One cause is what they call nocturnal bruxism. That's people who grind their teeth while they sleep. One treatment they can use is you wear basically a mouth guard like football players, athletes wear. There are lots of other things as well. We're not going to go into details because I don't know all of them. But some of you, usually when we hold this class in a classroom, there's usually at least one or two people in the room that have TMJ. It's relatively common. So now you know what's going on there. I mean, you know exactly where it's happening. And by the way, if you put your finger on your tragus, you know, that little ear flap, and you open and close your jaw and rotate it around, you can feel your TMJ. You can feel the mandibular condyle wiggling around inside of the mandibular fossa. It's also possible to get that dislocated. We'll talk more about that when we get to the joints. So the Palatine and the Vomer, people say Palatine, Palatine. I think I switch back and forth between the two, so don't try to model me. Palatine is an L-shaped bone. It's a very peculiar looking bone. So notice in the illustration, look at the what we call the hard palate, the upper bony roof of your oral cavity. Notice the front part of that is the maxilla. They call it the palatine process of the maxilla. The maxilla itself, it says horizontal plate of palatine bone. That's really just a tiny part of the hard palate. So it's at the very, very back. And then the palatine bone, again, is very weird. It actually comes up vertically, and it ends up forming the posterior part of your orbit, all right? So it's really hard to see. In class, I actually bring in palatine bones. They're weird little bones, weird shapes. It's really difficult to see them in diagrams. I'm sorry. There's just not much I can do here for you. The vomer, again, is the bone that is at the bottom. It forms the bottom half of the nasal septum. Again, that line that goes through the nose hole. For years, they always used to say it's the posterior part of the nasal septum. They would say the vomer is a plow-shaped bone, but I don't think anybody has any idea what a plow is anymore. Back in the old days, you had like a mule or a horse. You'd hook up the plow your fields, plant your crops. See that sort of purplish bone? I don't know what color that is. Project Runway, don't fail me now. I don't know what that is. You can email me with your suggestions. But the vomer is then that plow-shaped bone that forms the bottom half of the nasal septum. And then you can see that kind of reddish, I don't know, that burnt sienna, I don't know, the perpendicular plate of the ethmoid bone. Those two together form the nasal septum. So again, nasal septum, it divides nasal cavity into left and right sides. It forms the difference between left and right nostrils. formed by the vomer perpendicular to the parietal of the ethmoid and the septal cartilage. So notice there's a lot of cartilage here. The gray is cartilage. Once a person is dead, that cartilage all decomposes, and that's why you don't see a nose on a skull. The nose was all soft tissue. It all decomposed away. So a deviated septum is one that doesn't lie in the middle. That can happen either developmentally or through trauma. So Ashley Tisdale up there, she had a deviated septum, and they did some plastic surgery. Now doesn't her nose look beautiful? So you can see in there in that middle diagram on the right, that's a deviated septum. It doesn't go straight down the middle, curves to the side. Bottom right, that's Ken Shamrock, an MMA fighter. He's retired now, but he's been kicked and hit in the nose about 500 times, and his nose changes shape, 3 or 4 times on the way down. That's very typical. Boxers, athletes get smacked in the nose, you end up with a deviated septum. So bones of the orbit, this is just to try to show you, it's a complicated area. Look at all the bones that come together to form that. There you can see the lacrimal bone. Stop for a moment and check all these out. See the lacrimal bone there? You can see part of the ethmoid bone. You can see part of the sphenoid, part of the zygomatic. You can see the maxilla. So lots of bones. You can see part of the palatine bone there. Remember I said that was weird? Came all the way from the roof of your mouth up to the posterior part of your orbit. So eye socket, very complicated. A broken orbit, a fractured orbit, is actually a big deal. You can see here, by the way, the orbital fissures in the optic foramen. See, the orbital fissure is that kind of slanted crack, and the optic foramen is a little round hole. But a fractured orbit is actually serious. Every once in a while, an athlete, like the baseball pitchers, sometimes a line drive gets hit back at them. They don't get their glove up in time. I can't remember, there was a famous pitcher a few years back, got hit right in the eye socket with a baseball, and he was out for months. It's a very difficult area to repair because there's so many little tiny bones that come together. It's not easy to work on that area. A friend of mine in college, we got into a bar fight, and somebody took a pool ball and hit him on his orbit and fractured a bunch of those bones. And to this day, he's still, some of the muscles on that side of his face don't work right. One side of his face droops because the fractured eye socket ended up impacting his ability to move the muscles of his face. So you guys, don't get in bar fights, and if you do, don't hit somebody in the face with a pool ball. That's a really nasty thing to do. Affected him for his entire life. So the fontanelles of the skull. Again, at birth, the bones of the cranium are not fused together, and there's a very good reason for that. You've got to get a pretty big thing through a pretty small opening. So what happens is, during the birth process, the cranial bones will actually slide over one another to allow the head to get smaller to work its way out. And that's why after babies are born, they look really funny. Their head is like all slanted over to the side and sloped and stuff. If you want to have fun, go down to the maternity ward in the hospital sometime and point at the babies and laugh at them. It makes the parents feel good. It will all slowly go back to normal over a course of a few days. It's not a big deal. It's natural. That's the way it's supposed to work. So these are the so-called soft spots. When somebody's got a newborn baby and you go, "Oh, baby, let me hold it." They go, "Oh, be careful of the soft spots." Well, okay, sure. Soft spots, there's connective tissue in there. They're actually pretty tough, okay? I'm not saying to actually try to poke through them, but, babies are born and, things happen. And so your body is kind of prepared for that. It has its own natural protection. The so-called soft spots are still pretty tough, okay? They're unossified at birth. That means they haven't formed into bone yet, but they close early in a child's life. So the fontanelle is the little space. It's the little gap. So look in the bottom illustration. The anterior fontanelle closes 18 to 24 months after birth. That's because there's a lot of brain growth there in the front. So that's changing a lot. Notice you can see the metopic suture there on the frontal bone, that gap where the two halves of the frontal bone have not yet fused together. So anterior, how easy is that? It's named because it's on the front. It's the fontanelle on the front. And likewise, there is the posterior fontanelle. That's the fontanelle on the back. Right? You can't name things any easier than that. Then anterolateral. Look at the word anterolateral. In the front, on the side. And notice, therefore, it's on the diagram on the upper half, it's labeled sphenoid fontanelle. That's because it's right by the sphenoid bone. You can use either term. Both are used. You can call it anterolateral or you can call it sphenoid. Either one is okay. That takes 2 to 3 months before it closes. Then finally, posterolateral. Look at the word posterolateral in the back on the side. And mastoid is the name for that because it's right back by the mastoid process. So again, either name is fine. Begins to close 1 to 2 months after birth, can take a year to close. So fontanelles have 2 major functions. The first, of course, like I said, is that that big head has to get out through a pretty small opening. Bones can slide over one another. But then also, the baby's brain is growing during that, especially during that first year. So you've got to have room for the brain to grow. If all the bones of the skull immediately fuse together, there would be no room for brain growth. So those are really the 2 major functions of the fontanelle. That's something that I could ask on a quiz or on an exam. I would expect you to know the 2 main functions of the fontanelles. Okay, kids, we're done with the bones of the skull. We'll come back next and look at some more bones of the axial skeleton.